Bismillahirrahmanirrahim. Today we are going to discuss a very important topic which is hyperproteinemia. As you know, the hyperproteinemia means the presence of less protein in the blood. So there must be some normal blood level in the protein from which if the total protein or the major protein, that is the albumin, decreases, we call it hyperproteinemia. The normal serum total protein level is about 60 to 80 grams per liter, and the majority of it is albumin, that is 35 to 50 gram. 25 to 35 grams are the globulin, which includes alpha, beta, and gamma globulins. Gamma globulins, you know, are the antibodies which are produced for defense against the body. And then 2 to 4 grams is the fibrinogen protein, which is used by the body to clot the blood. So the major protein in the blood is the, you see here, I'll now discuss the mechanics around the capillary wall. This is the arterial end of the capillary and this is the venous end of the capillaries. As the blood flows through the capillary, the blood contains the protein albumin. The blood which flows is flown through the capillaries at a certain pressure, which is called the hydrostatic pressure of the capillaries. It is the pressure which has been generated by the heart. You know, as the heart pumps, the pressure in the water is 128 millimeter systolic and 80 millimeter of mercury diastolic. And this pressure continues to decrease as the blood flows through the larger to smaller arteries. At the arterial end of the capillary, it is 30 millimeter. So this 30 millimeter of mercury is pushing the fluid out between the cell walls, endothelial cells. Between the two endothelial cells, there is a space. So this fluid is being pushed, potentially being pushed outside through the interendothelial space at a pressure of 30 millimeter. Whereas at the venous end of the capillaries, the pressure further drops from 30 to 10 millimeter of the mercury. So here the pressure is 10. Now let us see what happens to the fluid which has been filtered from the blood into the interstitial space which lies below the skin. You know, here the fluid which now goes out of the capillary into the interstitial space, it should exert certain pressure on the capillary wall. You see here the hydrostatic pressure of interstitial fissure is minus 3 millimeter of the albumin. Why this pressure of the fluid which has been pushed out is minus is because at the venous end of the capillaries, the fluid is being absorbed because there is low pressure, and whereas at the arterial end of the capillaries is being filtered out, there are a lot of lymphatics which are continuously removing the fluid which has been filtered into the interstitial. These lymphatics lie below the skin and they act as lymphatic pumps. So as soon as the fluid is pushed over here, the lymphatics suck. So the lymphatics are maintaining a pressure of minus 3 millimeter of mercury which is exerted on the capillary wall. So 30 millimeter of pressure for inside, 3 from out. So since they are in the same direction, they become 33 millimeter of mercury. Now normally the blood in the fluid contains the albumin, and albumin tries to pull the fluid inside the capillaries from outside at a pressure of 28 millimeter of mercury, which is called the plasma osmotic or oncotic pressure. This is in the opposite direction. But small amount of fluid is also filtered out into the interstitial space which contains small amount of protein. The protein, although albumin is a larger particle and the proteins are large, they are filtered in very small. Whatever is filtered, it exerts a pressure outside the capillary walls in the direction which is the same as the hydrostatic pressure. That is, it is pulling the fluid out of the capillary wall because now the proteins are outside. That protein which is inside is pulling the fluid in. There's a lot of protein, 65 gram, but outside is a very small amount of pressure. So this pressure is 8 millimeter. So if we add 8, 3 and 30 which are in the same direction, it becomes 41 millimeter of mercury, whereas the pressure exerted by the plasma protein is 28. So the net filtration pressure at the arterial end of the capillaries is 30 millimeter of mercury. At the venous end of the capillaries, the head pressure is only 10, whereas the osmotic pressure remains the same because the plasma protein concentration remains the same. Rather, it is increased because the fluid has been pushed out, it's now concentrated. Whereas the other pressure remains the same. So the net pressure at the venous end of the capillary is -7 mil. So whatever the fluid is filtered at the arterial end, apart from the lymphatics which are sucking the fluid, the venous end of the capillaries actually absorb blood. That is why we don't find any swelling beneath the skin in the subcutaneous tissue, because there is no free fluid in the. That is the importance of the albumin. Now, if you see here that if the albumin concentration decreases, the plasma osmotic pressure will decrease. So the inside forces become less, outside will be more. So more fluid will stay in the subcutaneous tissue, and the lymphatics and the venous end, they have certain limitation. They cannot absorb all the fluid which is filtered. So if the albumin becomes low, more and more fluid is filtered out, because this pressure now becomes from 13 to it may become 18, 20. So that is how the swelling. You see here, these are the various causes of the albumin. You can easily remember throughout your life if you have a system. First is that you eat proteins. If the proteins are not available, you will not eat. And you know the proteins, high class proteins, that is meat is very costly, eggs are very costly, fish is very costly. So those who cannot afford, they will have low albumin in their blood, and they are more likely to develop hypoalbuminemia, and in the process they may develop localized edema, and if the protein is very less, they may develop generalized swelling of the body. The second is those people who by their belief don't take protein. For example, the Indians and the Hindus are vegetarians. They don't take meat because they think that it's a bad thing to eat the meat of the cow, etc. So first thing is that if you don't have access to the meat. Second is if you don't want to eat by your conviction or by your religious thoughts. Third is if you eat the protein, the gut cannot absorb. For example, patients who have got chronic, long-standing nausea or gastrointestinal disease in the form of vomiting or diarrhea, they will not absorb albumin, and their plasma protein would decrease. When the plasma proteins are broken down by the peptidases into small peptides and then into amino acid, it is absorbed into the blood and carried to the liver, where the liver forms the plasma proteins and the other body proteins like the albumin, the globulin, fibrinogen. So if the liver is damaged, for example in Pakistan it is damaged because the hepatitis B, C, and outside, and in the other people it may be damaged by taking a lot of alcohol. So all liver diseases, the synthesis of the albumin decreases. So in summary, if you don't take proteins, if you by convection you don't take proteins, if the proteins are not absorbed in the gut, if the proteins are not synthesized in the liver, you get low protein. Then if you lose lot of protein through the kidney, that is, the kidneys are, the blood passes through the kidney, and it washes out the urea, creatinine, and other drugs, and the uric acid, and so many other substances. So it is a filter which contains very small holes. If these filters are damaged and these holes become bigger, then the proteins are filtered also into the urine. So the person will have deficiency of protein. All these diseases are called the protein losing nephropathy, and they present a generalized swelling of the body, which is called nephrotic syndrome. Then we said that the fluid that is filtered outside the capillary into the space which lies below the skin, there the pressure is negative. So the lymphatics and the venous end of the capillaries, they suck the fluid which is our filter. Therefore there is no edema. But if you lose the skin by burns, the skin is lost. Now all that protein which has been filtered is evaporated and is lost to the exterior. The patient will develop low albumin in the blood. Then is the redistribution. If due to infection or sepsis, all the vessels in an area are damaged, then the permeability of the capillary will increase, and the more and more protein will be filtered out. That is called the redistribution due to inflammation. And finally, the hemodilution. For example, if you transfuse somebody 5 liters of 5% glucose or 5 liters of saline, so the 5 liter of blood becomes 10 liter of blood. It is diluted. The plasma proteins are decreased, so the osmotic pressure will also decrease. So one of the factors is the hemodilution. So in summary, low protein in the blood can be either due to decreased intake, or due to failure of the absorption from the gut, or due to low synthesis in the liver, or due to loss of protein from the kidney, or if the skin is damaged from the skin surface, and there may be redistribution because of the inflammation in which the proteins are filtered from the capillaries into the subcutaneous space, or if there is hemodilution due to the additive fluid. Now, this is again the summary of how the low protein occurs because of decreased intake, decreased synthesis, excessive loss, excessive catabolism. Again, you see here the anorexia, malnutrition, starvation, poorly balanced vegetarian diet, poor absorption in GIT condition, shift out of the intravenous space, hemorrhage, nephrotic syndrome, and there is one thing here, fad diet. We see here the fad diet is a bad diet. This is a diet which is more advertised in the media or in the TV or in the newspapers. It is called low carbohydrate diet, or grapefruit diet, the liquid diet, the low fat diet, detox diet, juice diet, cabbage soup, or macrobiotics. They don't contain albumin. They may be good diet as far as the low calories are concerned. They may be good diet for weight reduction, but they contain less protein. They may cause, if you take a lot of fat diet over, will cause anemia. This the kidney disease, I'll elaborate further, because in the kidneys we know that as the blood filters to the glomerulus, it passes through the membrane. What is this membrane which contains filter? It consists of basement membrane, which is formed by the collagen fibers, and there are endothelial, there are blood cells on one side, and the epithelial cells with their foot processes. The epithelial cells of the kidneys are attached to the basement by their feet. So that is called the foot process. This is the normal arrangement. But if you develop some disease in which one of the structure, either the basement membrane or the endothelial cells or the epithelials are damaged, you develop a disease called membranous glomerulonephritis. If the membrane is thickened, the membrane is thickened, it becomes thickened membrane, and the disease is called membranoproliferative glomerulonephritis. There is a third disease called minimum change disease, in which the patient has in the blood the albumin is very low, the patient is swollen. Usually these are children, but if you do the kidney biopsy of these patients and send to the laboratory, histopathologist says that I can't see any change in the kidney pathology. So we call that condition as minimal change, because in the light microscopy the histopathologist can't see any change, so he labels the disease that is the minimum change glomerulonephritis. But if you see the same slide under the electron microscope, you will see that on the basement membrane the epithelial cells have lost their foot processes. So they are attached to this the basement membrane by the foot process. So this disease is also known as loss of foot processes disease. So in the light microscopy there will be no change, but if we see under the electron microscope, there will be the epithelial cells will have lost their foot process. So in the glomerulus, if only a part of the segment is damaged, we call a focal segmental glomerulonephritis. Or if there's the third type of cells which support all these cells, epithelial cells, these are the connective tissue cells which are called the mesangial cells. If any drugs or any other condition affect these cells, we call the mesangial proliferative glomerulonephritis. If the immunoglobulins, especially the IgA, filters into the kidney, we call it as IgA nephropathy. All these kidney diseases may occur alone or may part of the systemic disease. For example, all these conditions can occur in diabetes mellitus. It can occur in systemic lupus erythematosus. There's a disease called amyloidosis. It can occur in infection like malaria, hepatitis B and C. It can occur syphilis. It can occur in certain cancer, for example, lymphoma of the kidneys. And then we use drugs like the gold salts and non-steroid anti-inflammatory drugs like the aspirin and brufen in these conditions. In these drugs can cause damage to the kidney and therefore result in low protein. But the another cause of generalized swelling is the certain diseases of the major organ. For example, you see here, if the heart fails, what is the function of heart? Heart brings blood from the capillaries through the veins into the heart and pumps to the lung to filter it. If heart is damaged, the venous return will decrease and more fluid will stay in the capillaries, the hydrostatic pressure will increase and there will be filtration throughout the body under the skin, and it will result in generalized swelling which is called anasarca. Similarly, if the kidneys filter a lot of proteins and if the liver disease don't make protein, or if you are having low protein due to any cause, in all these conditions there is generalized swelling. Moreover, there are certain other conditions like if the fluid accumulates outside the heart, pericardial effusion, if the pericardium becomes thick and constrict the contraction, it's called constrictive pericarditis. Moreover, in hypothyroidism, and certain drugs will also generalize swelling. So these are the various causes of generalized swelling. This includes the cardiac causes, the kidney causes, liver causes. And this is, you see here, the swelling of the leg. Those who keep on walking and they are up and about, there the fluid accumulates on the lower part, dependent part. And this edema, this swelling is called edema. And if you press with a finger, as you are seeing here, there is a pit. So there is a depression or pit. So that is why this edema is called pitting edema, because it contains low protein. There is another type of edema which occurs when the lymphatics who are draining the subcutaneous tissue, the excess of fluid, if these lymphatics drain into the regional lymph node, if the lymph nodes are removed by surgery, or they are damaged by cancer, or they are blocked and damaged by the radiation, the patient will develop the swelling because now the lymphatics will not drain. This is what happens in the cancer of the breast. You know, the upper limb and the breast, they drain their lymph into the axilla, and in the axilla there are 5 group of lymph nodes. The lateral group of node, the medial, which is anterior, posterior, central and apical. So if there is cancer of the breast, the disease will spread into these lymph nodes. So by surgery, when we remove the breast, we also remove all these lymph nodes, and then we go for radiation and then the drug therapy. All these damage the lymphatics and which are draining. The same lymph nodes are draining the lymph of the upper limb. So if you remove the lymph nodes, or if there is cancer which is blocking the flow of lymph through the lymph node, or if the radiation which we give after the operation, it damages the lymph node, these lymphatics will be blocked and there will be swelling on the limb. And if that swelling you apply pressure, it will not pit. That is called non-pitting edema. So among the causes of non-pitting edema are the lymphedema. Any edema which is due to obstruction of the lymph is called edema. You say here, if the swelling is much increased, even the vocal cords, that is the upper end of the trachea, the swelling, and if the swelling is massive, is totally blocked, so you may have to go to make a hole in front of the trachea, tracheostomy, otherwise patient. And if the patient is lying most of the time on the bed, the fluid accumulates over the sacrum, lower end of the sacrum, and you see here, if you press here, there will be edema. And lastly, you see here, in all those general conditions, if the heart is failure, or the kidney disease, if the liver disease, or if the albumin is very low,
it becomes generalized anasarca. So with that, we finish our presentation, and